Today's topic is artificial intelligence and global health innovation. Hello, everyone. We are very lucky to have here an expert, Professor Chirantan Chatterjee, who teaches in the UK. He's going to talk about this emerging and very important topic. Over to you, sir.
Thank you, Subodh. Hello, everyone. I am Chirantan Chatterjee, who is a reader in economics of innovation at the Science Policy Research Unit at the University of Sussex. I also maintain a visiting fellow affiliation at the Hoover Institution, Stanford University, and am a visiting professor of economics at IIM Ahmedabad, India. Today, I want to walk you through some insights around what is happening worldwide with artificial intelligence, and more specifically to the sector I'm interested in, which is in global healthcare markets.
Okay. Wonderful. Let's go.
All right. So I do have some slides, and let me just go ahead and share some slides, and we can then switch it off after my initial thoughts and have a conversation, Subodh.
Okay.
So, talking about artificial intelligence and global healthcare innovation is probably even more salient today with new challenges that are incident on us as a global society and as a one world, especially with the pandemic, and more so with the Anthropocene and the rising incidence of zoonotic diseases. So how is global healthcare innovation and global public health, GPH, looking post-pandemic? The other day I was at a London pharmacy, and I caught this article on the Guardian, which talks about how pharmacies are now being used in the UK to enable prescription of drugs and to ease some of the pressures that are happening with the NHS in the UK. Now, this clearly tells you that there are big supply side frictions from countries here in the Western world to even in the Eastern world. And differential approaches are being followed to respond to it. There are approaches that are building on business model disruptions, like the one here in the UK, to using artificial intelligence to complement some of the brick and mortar healthcare provisioning that's happening in the low and middle income country context, like in India or China. And associatedly, what we are seeing is a global heterogeneity in the way AI and digital health is diffusing in these markets. So we see like a leapfrogging type of tendencies in the global south, whereas in the global north, we see digital health moving with caution, with discussions also around the privacy of healthcare data, on how ethics of using digital health data for prediction as well as for understanding the burden of diseases are evolving over time, and regulation taking its own direction associatedly.
Wonderful.
Last month, I was in China, and one of the conversation was there about how can you use artificial intelligence and new age technologies in global health to prevent what they call as prevention is better than cure. So Fang Huan we ran. Forgive me for if there is any pronunciation hassle there, but basically that Chinese phrase stands for prevention is better than cure. So the larger direction of travel here is that how can we use artificial intelligence, big data, and digital health to catch diseases early, ease some of the pressures on the supply and demand side in global health, and what role can AI play in this particular conversation? Now, but having said that, there is also an associated conversation that health economists are thinking of, which is what does it do to overall sustainable development goals 2030, which has already been under much pressure with the pandemic and its associated challenges. A related one is around universal healthcare coverage. How will the insurance system factor in new technologies and artificial intelligence-driven healthcare, and who will pick up the prices that one may have to pay for as a general citizen of any country? These also relate to industry debates around monopoly power. So a classic debate in the health context and more broadly in any public good context is we need more innovations coming out from the industry, from entrepreneurs, from large and small companies. But to facilitate that, policymakers sometimes provide intellectual property incentives like patents, but that also results in artificial creation of monopoly power, and that excludes many from the market. So the associated trade-off that policymakers then do is affordability of healthcare, which is the access debate that is traded off in some sense when you are focusing too much on the innovation incentive conversation, and vice versa. If you are focusing more on the access conversation with, let's say, healthcare price regulation, you will end up trading off innovation for better quality of medicines tomorrow. So that's a debate everywhere in the world,
Right.
not just
Yeah.
India or UK or China or the US. And lastly, you will see also, starting from the US to the UK to India and China, there is a larger conversation on, especially in the context of goods like healthcare, as to who should be provisioning for it. So with the Inflation Reduction Act in the US, there is a larger move towards public health and public making medicines more affordable through the Medicare and Medicaid system in the US. Here in the UK, there is a conversation on how much is NHS getting competed out by private healthcare providers. And we know the situation in India, for example, where private and public healthcare providers are competing with each other. And this has differential implications for ultimately choices, prices, and welfare for the common citizen who are trying to look at this in the context of the broader AI and global health innovation debate. So those are the 6 things to think about while pondering about artificial intelligence and global health innovation. Number one, there are supply side frictions which can be immediately resolved. The rise of digital health has to be thought with the idea of preventing the burden of healthcare. There is a conversation that policymakers need to engage with in terms of how regulation can facilitate adoption of new age technologies, digital health, and AI. And also at the same time, keeping a dynamic orientation to it, not to get distracted from the access versus innovation debate. And finally, what balance between public and private health we should be thinking about while pondering the AI disruption in global health markets.
Okay, let me ask you a question. You wrote post-pandemic. So the situation was different before the pandemic, and has the pandemic changed it, or you are just saying, look at it now?
I think the pandemic has, if you take a standard demand supply approach to this, the pandemic has suddenly shifted the demand curve out. For the same price, people have become more conscious about healthcare. I know from anecdotal conversations, people are buying more healthcare insurance plans in India, for example, and we are wearing like wearables to catch our health metrics on a daily basis. So we are more healthcare conscious, which means the demand for healthcare has gone up for the same prices. And on the supply side, given how technologies have been used in the pandemic era, I think there is also a pushing out of the supply curve. So the equilibrium that was there between in the demand and supply of healthcare before the pandemic has shifted outwards. And it's unclear whether that means more choices and welfare enhancing effects on patients and citizens, or is it going to be at the trade-off by trading off some of the price conversations that will happen in the new equilibrium post-pandemic.
Okay, thank you. Let's continue.
Okay. So what I'm saying is that worldwide, obviously there's a big conversation on AI generally, but there's also conversation on how AI is going to help global health. I mean, day before yesterday, Microsoft announced that they have developed some new technologies. There's big event where Satya Nadella and others said that there is new technology that will essentially make technologies like CT scans and MRIs obsolete over time. And we will have like AI-enabled sensing and predictive abilities from large data sets. And it's being predicted that global healthcare spending, while it increases, will be driven largely by all of these AI-enabled solutions. But and it seems like business leaders agree to it. The question I want to raise is, are these business leaders right? What are the doctors thinking in this story? What is the role of the healthcare policymaker? How should we think about public versus private health insurance? And ultimately, the authenticity in the solutions that are going to be provided in healthcare markets. Are patients going to trust in chatting with telemedicine enabled doctors or digital doctors? Are they going to trust if you are told in a digital or AI enabled sense that this is the likelihood of you getting cancer, etc., etc.? So there's a underlying trust question that is going to guide the ultimate equilibrium in the supply side and policy level push that's happening in AI and global healthcare markets. So there are many open questions, and evidence is very heterogeneous. Few weeks back, there was a paper circulating in the Journal of American Medical Association saying that patients seem to be trusting ChatGPT conversations more than doctor conversations, whereas I have worked to show that that may not be the case in a different cultural context, like in India, which I can come to in a little while.
Okay. All right. Yeah, no, could I say that the human side is also critical. It's not just the knowledge, it's not just the technology, but the human side of it, the interaction between the patient and the doctor. That may actually lead to better outcomes. But anyway, let's go ahead.
No, you're absolutely right, Subodh. So I think I will show you a couple of papers that I'm working on right now, and this will attend to your point about the relationships between doctors and patients and what may be happening to it with AI in global healthcare markets.
Yeah.
So the first paper I want to talk about is this study that I'm doing now with my co-authors from IIM Ahmedabad, which is about the demand side, the relationship story that you just mentioned, Subodh. So what we did in this study was we worked with a digital mental health platform company in India and intervened users to respond to either a chatbot or a human mediator, and then explore who is more likely to influence the user to adopt that platform. Okay, and what we find is that a prompt by a human mediator is actually increasing take up more than artificial intelligence chatbot enabled prompt, which is very different from the paper that I was telling you from the US. So the point is that there are some, we need more body of work and evidence to see how culture might affect this trust and authenticity conversations as you use AI in intervening in global healthcare markets. This also relates to a larger point in AI, which is goes back to Alan Turing's works. When Alan Turing was making his Turing machine, he was saying that the ultimate test of AI is whether it can completely substitute the human being.
Right.
And in that's what he called as the Turing test. But Eric Brynjolfsson and others from Stanford, for example, are talking about how societies and companies are trying to make that ideal machine. In the process, they may be running into a Turing trap. And that is something that is definitely to be thought through carefully in the relationship, in the interaction conversations, or in the data evidence that I'm bringing here in one of my studies, which I think in a broader sense also makes sense on the demand side. So when Microsoft comes up with an AI-enabled intervention, how will it be trusted and diffused in the market? Will have a very strong relationship with each other. And it will not just be the price factor that is going to guide the adoption of such interventions. So that is something we need to be aware of, and we need to study more, and we need to generate more evidence, both from different, from global north as well as global south, is what I'm trying to argue here.
Yeah, good. We understand that. Look, this is not yet a clear-cut case. You know, it depends, and what it depends on, we really don't know. So we need to look at it some more. All right, fine. Let's go.
On the supply side, there is a big conversation on where exactly AI can help. Can it help in improving R&D productivity of healthcare firms? And if it can help there, where exactly can it help? So I have this study on pharmaceutical R&D productivity, which is a grand challenge. It takes like $2 billion to get out a new pill in the market after 10, 12 years of studies, and 1 in 10,000 companies ultimately reaching the market. So I'm seeing some evidence on patenting data that post-COVID, there is a larger uptake of AI in the patenting that is happening from the life science firms. And this data sample is basically artificial intelligence patenting data set from the US Patent Office. And I see this uptake of AI imprinting on the life science patents more for firms which had a priori made investments in AI or technology, not for other firms. So if a firm is technologically ready, it seems to have taken the COVID cue and are using more of AI-enabled innovations that is showing up in the patenting data of these pharmaceutical companies.
Okay.
So this attends to the question of, number one, people have grumbled that healthcare sector has been a little slow in adopting AI to improve its efficiencies. Doesn't look like so from the data that we are seeing post-COVID, especially for the technologically ready firms. And the second point is that what we are seeing here in pharmaceuticals, how does it broadly generalize? We don't know, but there needs to be studies on this, broadly generalize for healthcare R&D and more broadly for manufacturing R&D as well. So we need more studies going forward to see what on the supply side is happening with the adoption of AI, just like we need studies on what is happening in the demand side with authenticity conversations in AI.
Okay, let me ask you a question which may be outside the scope of this conversation. If AI is successfully applied on the supply side, what do you think would happen to the supply side? Would it improve a lot or just be marginally affected? What kind of changes would be seen? Do you have any sense of that?
I think what we'll see is exactly what is happening in the generative AI context, which is who will adopt it?
Yes.
Is it going to be a new company or an established company? The competition effects of that. And each party is going to try to protect their rents, having applied AI to their supply side efficiencies. So suppose Microsoft comes up with a solution or Google comes up with a solution which intervenes with generative AI and does things better for them on the supply side. They will try to protect the market trends by either patenting it or by business model solutions to it. And as a result, we might see more market power that is being given out to the top big tech firms who are using AI more broadly, but also specifically in the context of solving some of the frictions in the healthcare markets. Now, this means that we need regulatory intervention. So if there is an unfettered growth of monopoly power because some firms are better able to use AI to generate supply side efficiencies and protect those innovations that are coming out, regulator will probably have to step in and say that, no, you may or may not be granted patent on that particular product that you are doing using AI for supply side efficiencies. And we'll see this back and forth happening over this entire decade, I think. And we'll see some big ticket court cases, sometimes enabling enhancement of market power, other times destroying enhancement of market power, sometimes nullifying certain mergers when these big companies go and acquire startups which are doing cool work, other times okaying mergers, because this has an implication ultimately for social welfare, because unless you intervene, the balance between welfare and innovation, again, going back to my first slide, will otherwise tilt in a certain direction that is societally problematic.
Okay, let's proceed, please.
Now, this supply, so something is happening on the supply side, something is happening on the demand side. Now, the question is, which comes first, right? Does demand, the changes we saw with demand, is that going to create new requirements from the companies to solve the way they are doing their business and their R&D and their manufacturing? Or is it that companies are going to push out new solutions with adoption of AI, and especially in a health and pharma context? And in that world, they will then be able to push the demand side to follow what the supply side is giving them. So there's a classic question in economics, which is from the Say's law, which talks about supply creating its own demand. And sometimes it does happen that supply doesn't manage to create its own demand, and in that world there is excess supply, less demand. And we have seen that being a reason for previous generation of innovations and technologies sometimes taking off and other times dying, disappearing from the market. So what I'm saying is that we will have to keep now eye out on this Say's law and in this general equilibrium story going forward. There's a meme I'm showing here. So somebody is showing this nose, selling these nose puppies and nobody really knows. This is the seller who is trying to argue there is a use for these nose puppies, and here comes our man from the demand side asking, "What's a nose puppy? Educate me. What's a nose puppy?" And there's a information given, which is, "Oh, it's a little ceramic puppy that fits in your nose," and says that find a need and fill it. So we'll see this tussle between the seller and the buyer in understanding what are the new needs with the AI-enabled solutions that are happening in global healthcare markets. And we will have to see which wins in the long run as equilibrium stabilizes across different geographies of the world.
Okay, wonderful. Let's go ahead.
Now, this is where I would argue new evidence and handshakes matter. So I talk this from a context of what's happening in China and India, two of the most largest populous democracies. We know that China is doing a lot of work in digital health and AI. And we also know that India is creating a India digital health network by itself. The sad part of this story is that they're not conversing with each other. Neither are they conversing with each other on the supply side, which is in terms of technology collaborations, nor are they conversing with each other on the demand side, which is benefiting from their solutions for each other's markets. And it shouldn't be. My argument is that it doesn't need to be this way. We can actually come together and do better for not just 1/3 of the world's population, but for the rest of the world as well. So that is what this slide is trying to argue, that this AI and global health innovation, the topic for today, has a larger geopolitical context, which is that if these two economies can come together on the supply and the demand side, I think not only will they benefit, but the world will benefit in taking the larger conversations on affordable quality healthcare forward.
Okay, wonderful. Let's proceed. Yeah, sorry.
Yeah. Finally, I would say that, this is a little bit of a plug of my department, Science Policy Research Unit at University of Sussex. So if you look at the history of SPRU, it's a 60-plus-year-old unit set up by the most respected Chris Freeman, who was talking about how to think about national innovation systems. And what I'm arguing is that we have expertise and capabilities historically on how evidence should drive the conversations around science, technology, and innovation policy. So my argument would be to use what we have or to replicate what we have created in these last 60 years in different geographic contexts and guide national level science and innovation policy conversations. So we have a large capability in influencing some really important things, starting from how the United Nations is thinking about science and technology and innovation as a driver of economic growth, or how technology foresight happens. This is something that we should be focusing on to recreate in different geographic contexts. And I should add that it's fascinating to see that when you, as a SPRU faculty, go and interact with colleagues from Kazakhstan to China to Egypt to Bangladesh to Pakistan and India, there's a large appetite to actually use the ideas that we have created historically to drive these conversations, and not just in the context of healthcare, but more broadly in other grand challenges that society faces.
Okay.
So that's my small little slides. Business school professors tend to feel comfortable with slides. So
no, slides are fine. You can even show videos. This is a Zoom call. You can do what you like. I'm happy to have slides. Some people like to show them and some people don't. It's fine. Okay, let me ask you two, what should I say, outlandish questions. Okay.
Yeah.
One is, do you think that overall this movement of AI innovations is going to help developing countries in terms of economic progress? And what will it do to inequality? Now, no one knows the answers, I agree. But just what your thinking might be along these lines. Is this something that will ultimately trickle down to the developing countries, and will it actually reach the poor in the developing countries fast enough, maybe in the next 10, 12 years, whatever that you want to think about? These are tough questions. So I'm not saying that you should be ready to answer them, but this is what people would ask me. So I'm asking you.
Okay, you were giving me another question. You want to give
These
that
are
or?
the two parts. One part is, will it reach the developing countries? And the second part is, will it reach the poorer people in the developing countries? Can we expect to see, say, increases in life expectancy in developing countries because of AI, global public health innovations? To put it more bluntly, will the growth rate of life expectancy jump up in these countries, where we are actually not seeing such a rapid increase anymore? I mean, this is just speculation,
Yeah.
obviously.
So I think there is a yes and no to this answer. The yes part is, if you look at the demographics of some of the developing countries in Asia, uh, India may be actually doing well on population right now, but it also has started aging,
Yes.
just like China has started aging.
Yeah.
Which means that aging brings a different types of a health demand for a health conversation than for a younger economy. Which means that you might need AI-enabled solutions for solving, let's say, human capital issues or skill issues, or where you may not be able to reach, where AI can help you with remote reaching.
Right.
I am hopeful that is happening. I am hopeful that will happen from innovators in the context like in Global South, because they have more pressing challenges to solve, and that gives you use cases to more sustainably create solutions that trickles down to the base of the pyramid. But that being said, it is also true that we have to be cautious about the inequality implications. And I have a study here, which is that, and this is where we go back to the universal healthcare who will pay for all this stuff, right? So if you can't pay for trickle down AI solutions at the base of the pyramid, then like for advanced medicines, you will get excluded in the market, or you will end up consuming generic versions of these solutions, which are of poorer quality. And this will have an implication. This will cut not the way we were thinking they will cut in terms of the life expectancy outcomes that you said. So we were hoping that the large mass of villages and cities, rural cities in India will give you the perfect opportunity to create these more holistic, sustainable trickle-down AI solutions. But if they end up excluding these people who cannot pay for these products and solutions, and there's not enough of a health insurance enablement here, then we will see the inequality that we have seen with liberalization in India since 1991. I mean, some of the larger societal movements that are happening in India today is probably tracing back to how India liberalized itself, and how the richest won the race in transforming the society, whereas the poor people haven't been taken care of enough. So now we see the return of like the what they call as the revenue economy, right? So they're talking about the state support and all that. So we will need that kind of a thing to be cautious. I mean, if you have learned anything from gains from globalization and it as a double-edged sword, that should immediately translate into how we manage the translation of AI to the base of the pyramid in the Global South.
Okay, that's great, very helpful. Okay, let me just ask a final question. Do you have any examples that you know of where AI has made a big hit or has a great success in any sense? I'm asking in a very broad sense, Do you know where AI in health sector has been shown to be very helpful? In any country, anywhere, at any time. I'm just saying, look, if you know any example, then perhaps you can tell us that. I don't know, but I'm asking you because I'd like to know whether a person like you knows of any such example.
Yeah, so I work with LV Prasad Eye Institute in Hyderabad, and they have this model where they work with the health camps in villages to get patients to the hospital, and they have a cross subsidy model where the poor don't pay, but the rich pay to cross subsidize the poor. Now, doing health camps is not cheap. So LV Prasad is actually working with Microsoft or Oracle, one of the technology companies, such that it can use big data to catch retina and cataract conditions earlier, such that you can get the patients to the hospitals even without organizing health camps, or even without sending doctors on site with these health camps in these villages. So if you have a predictive algorithm that plugs in some inputs from the patient in the village, which is on a machine, and tells you, okay, this is likely to be actually stage 3 cataract and should be immediately intervened.
Yeah.
That basically reduces the need for very costly health camps and doctors to be sent in these health camps, etc. So that's one quick example I can give you. I can tell you that in the pharmaceutical world, the US FDA and also here MHRA UK are exploring a bunch of digital therapeutics, which are essentially AI-enabled medicines, which they call as digital therapeutics. The names are escaping me, but if you Google up digital therapeutics UK, digital therapeutics US, you'll get a bunch of these solutions as well. In a more what do I say? In a more lazy way, you can think about how, let's say, the watches, the smart watches that you wear today,
Yeah.
have like various parameters that they are catching, and the more advanced ones are even giving you like suggestions on how to use these parameters, daily health parameters, to
Yeah.
be aware of an impending cardiovascular stroke or something like that. Apple watches, I don't wear Apple watches, but I hear that there are these underlying algorithms that are now embedded in these watches that
Mhm.
help you catch the disease early. So these are 3 quick examples that come to me on how AI is being used in
So
health.
in a way, they are reducing your diagnostic costs.
Correct.
Right? Because you are able to say, oh, we don't have to diagnose whether this person has cataract or not. Our prediction is that chances are very high that many people here have, so let's get them in. So you don't have to diagnose it in advance. You just do it. The healthcare watch also is diagnosing you on a regular basis. You don't have to see a professional. So what I hear you say in this is that diagnosis is faster and cheaper, may not be accurate 100%, but is probabilistically workable.
Probably. And it's not just diagnosis. So there's a company called Intuitive Surgical, which sells a large number of robotic equipments for surgery. I saw a demonstration of that in China recently. It's also now there in various Indian hospitals. In conditions where you have like the imprecision of the doctors not to be able to, like laparoscopic surgery doesn't help you get exactly where it does get in, or where you need the expertise of the doctors, you can replace that with robotic surgery. For example, if you have spinal stenosis and you have to just decompress a couple of spines because with age you bend, and a lot of Indians get this, in that world, you want a non-invasive robot to go in and decompress that portion of the spine. And Intuitive Surgical has now deployed many robotic surgery in developing world context, of course, in developed world context. And apparently research is showing that our health outcomes are better with robotic surgeons than with human surgeons. So that's another place where beyond diagnosis, some AI intervention is
so it's actually curative. I mean, in surgery, it's well known that some of it is remote controlled and robotic anyway. You know, it's becoming more common. Okay. Any final thoughts that you want to share?
I want to not forget that there is a question around the privacy of the data that is going to be generated as you use AI in healthcare, and the ethics of using AI in healthcare. So that's where I see a little bit of lazy consciousness, especially in the global south. It's a place where, let's say, the more resource endowed economies like the UK can have a moral stance in, but privacy of the health data and the ethics of using AI in health is equally important for somebody who may not be rich enough. And we need to, as a social planner, be absolutely cognizant of that as we try to diffuse AI on the supply side or on the demand side of healthcare.
Okay. Well, thank you, Professor. That was very enlightening. I must say that I started from 0, and maybe on a scale of 0 to 10, I've reached 3 or 4. I had no idea of all these things. So it was a very good thing that you did. You explained it to us so well. And thank you so much. Let's say bye to the viewers, and maybe we'll come back to you in a year or so to ask you how's it going, what are the changes, what do you see in India and China. Okay, bye-bye.
Thank you, Subodh. Thank you for inviting me. Take care. Bye-bye.